Thanks, Minister. And it is a sad day, I think, in many ways, for a lot of the construction industry workers, a lot of people who've been doing the right thing, that unfortunately aberrant behaviour amongst a minority has led to a very substantial public health risk that the Minister is taking you through, and I'm sure the Chief Health Officer will be happy to elaborate. But what we have seen is a need for the government to intervene and take strong action consistent with the Chief Health Officer's orders in order to protect the community, but also to protect those workers, their workmates, their families. What we are seeing as a consequence of these events is the construction industry is effectively amplifying and spreading the virus into communities, particularly in the north and the west of Melbourne, but also the southeast, and then back into other workplaces, because the nature of this industry, both a young industry and a highly mobile industry, is one that moves across a variety of workplaces. So we put the industry on notice, you'll recall a week ago, that we needed to see a substantial improvement. And we made it very clear then that the permitted worker status would be reviewed if, in fact, those issues were failed to be adhered to. Since then, we've seen poor compliance and further transmission sites being identified, and that just cannot continue. We can't simply have an industry as one of the focal points, one of the greater areas of activity of the virus spread in the community, not adhering to the safe requirements for work that we put in place. There is non-compliance across a range of construction sites. You'll recall when I spoke to you last week that we said that we would put a safety blitz in place. We were hoping to get over a 2-week period something like 7,000 inspections done. We haven't got there yet, but what we do know is close to 50% of the sites inspected have failed to meet the safety requirements when they've been inspected by authorised officers. So there's been a spread of transmission from site to site and transmission into households from there. The issues are not just limited to CBD construction. Of the enforcement activities undertaken over the last week, there has been a very high non-compliance rates identified. We've also seen some appalling behaviour on our streets, which in itself is a public health risk. And can I be clear that we've got no tolerance for the kind of behaviour that we saw take place outside the CFMEU offices. Having spent a long time working in the trade union movement, I can assure you that sometimes this government does not see eye to eye with the trade union movement. But we've always had a respectful engagement because we recognise that they do vitally important work for their membership. And their safety, their membership safety, is vitally important to them. And of course, a safe workplace, which is what the CFMEU officers are, is vitally important to this government, as it is for us to every workplace. So what we saw the other day was reprehensible. So we're acting, can I say, decisively and without hesitation on the back of the Chief Health Officer's orders. The Chief Health Officer, of course, has the responsibility to take these actions, but we stand without hesitation or reservation in support of those orders, and we believe that they are absolutely appropriate in the circumstances. I met with industry stakeholders and union representatives together with Minister Allen and Minister Pakula last night, and we made it clear to them that the orders would issue and that we would take the necessary steps implicit in those orders to protect every single Victorian. And it can't be that a permitted worker category carries with it some implied entitlement to put the rest of the community at risk. It does come with an obligation, and that obligation is to ensure that every Victorian, to the extent that they can impact upon it, is protected by their right to be able to go about their trade, a right which is not available to a lot of other people in this community. Ultimately, the government was left with no alternative but to shut the industry down, shut all work on site in the construction industry for a 2-week period. The construction industry must take this opportunity, and I'm sure, I have been assured, will take the opportunity to reset and to restart the industry. And that is vitally important. We cannot simply go back to the way things were being conducted. Broad-scale non-compliance across the industry that was constituting a threat to public health in the most dramatic of terms. The construction industry, I think, has made it clear that they too share the values that the government has around making sure that the industry is reset, restarts, but in a safe way, and that the changes necessary to get the appropriate approvals to commence work are underway. So we do recognise that there are a number of workers and builders who have been doing the right thing, quite a number, and for them this will be a source of considerable disappointment and, might I say, economic trauma. So we haven't taken these steps lightly. We are very conscious of the implications of the decisions we've made, but it's necessary really to protect workers in the industry and the broader public. All construction projects in metropolitan Melbourne, in the city of Ballarat, the city of Greater Geelong, the Surf Coast and Mitchell Shire will be closed. There will be a strictly limited exemption for those workers who are involved in the process to attend the site, to deal with an emergency or to perform urgent and essential work to protect health and safety, but the process of demobilising these sites will commence immediately. An amnesty has been put in place so that a limited number of workers can attend the construction sites in order to assure the demobilisation of those sites is done safely. It is a difficult task to close this industry down, to stop its economic activity, and it will be an equally challenging time to start it up again, and an enormous amount of work will be required to get there. All government construction projects in metropolitan Melbourne and the relevant LGAs that are subject to the CHO's orders will be closed, with no new work to be commenced other than work required to make the site safe and secure. The health and safety of every Victorian, of course, is our #1 priority, and the government will take all steps required by the Chief Health Officer to render public safety our priority. So that goes for construction workers who can, of course, as I told you last week, get vaccinated, and they'll need to be vaccinated. We've made it clear that the shutdown will reduce movement, it will minimise transmission, and it'll also allow the entire industry to appropriately adopt the Chief Health Officer's directions, including increasing vaccination rates. All sites will be required to demonstrate compliance with the CHO's directions prior to reopening, including the requirement for workers to show evidence that they have in fact been vaccinated, had 1 dose of the COVID-19 vaccine before they return to site on the 5th of October. So from 1 minute to midnight last night, all construction workers will require at least 1 dose of the vaccine, from 11:59 on the 23rd of September. The timeline is that all workers will require at least 1 dose. Of course, given the shutdown in the industry, we'll be able to ensure that the requirements to meet the opening obligations of the Chief Health Officer have been met well and truly in time for the 5th of October anticipated opening. So we're going to continue to work with stakeholders. This is going to be a very difficult time for a lot of people. I also will make the point that Minister Pakula and I are having discussions about what we can do in terms of support and assistance for particularly the smaller operators in the industry, and of course the disaster relief payments that are available from the Commonwealth will be available to employees in the industry as they are affected by Chief Health Officer orders.